Okay, good morning, colleagues. Thank you so much for joining us in this session on implementation and financing of AMR National Action Plans organized by WHO Africa Office. We are pleased to have with us as moderator Dr. Otrida Kabuna. She is WHO Afro Consultant Member of WHO Strategic and Technical Advisory Group for AMR. She will lead the session, and in this session we will have 3 presentations from country experiences from Ghana, Uganda, and Egypt. And then we will have half an hour question and discussions. So please start writing your name and affiliation in the chat box, and kindly mute yourself if you are not talking. And as we start the presentation, feel free to put some questions in the chat box and the presenter will answer. Thank you so much. Over to you, Otrida.
Thank you so much, Chadia, and hello, everyone. Welcome to day 4 of the 2021 Africa World Antimicrobial Awareness Week campaign. We kickstarted this week on Wednesday with a high-level event with 3 panel discussions that were focusing on 1, adopting a One Health approach and multi-sector coordination mechanism for antimicrobial resistance. We had 1 panel that was looking at implementation and financing of national action plans in Africa. We also had a 3rd panel discussion that was looking at legal frameworks and regulation relevant to antimicrobial resistance. We had very engaging and very fruitful discussions, and we listened to some lessons around how best to implement AMR relevant policies and how the tripartite plus Africa CDC and other partners can better support, strengthen antimicrobial resistance coordination, as well as implementation of national action plans at country level. On the 19th, we had another webinar that was focusing on regulation and legislation relevant to AMR, the challenges, the potential, the opportunities that are out there, as well as available support from regional economic communities. Yesterday on the 21st, as a way of raising awareness in the African region, we had a Twitter chat focusing on AMR in the African region. And this was basically a platform for different stakeholders and individuals to come together and share their ideas and experiences on how best we can raise awareness in the African region. So today we deep dive into something more practical, as we're going to be looking at actual implementation of national action plans in the region, in Africa, as well as how do we best finance implementation of national action plans. As Chadia has already said, we'll be hearing experiences from 3 different regions. We have Uganda, we have Egypt, and we have Ghana sharing their experiences. Please feel free to type your questions in the chat when we have the question and answer and the time for discussion. Hopefully we can answer as many questions as we possibly can. But at this time, allow me to call upon Dr. Walter Fuller, the Technical Officer for Antimicrobial Stewardship and Awareness, who is with WHO Regional Office for Africa, to give us the opening remarks. Dr. Fuller.
Representatives from the tripartite, representatives from Africa CDC, AU, IBA, chief executives of the various agencies, representatives from member countries, representatives of the various civil society organizations, representatives of intergovernmental agencies, representatives of non-governmental organizations and scientific institutions across sectors, distinguished participants. It is with great pleasure that I welcome you all today, which is day 4 of the 2021 World Antimicrobial Awareness Week campaign for Africa, focusing on implementation and financing of antimicrobial resistance national action plans. Although not very common to most, AMR is without a doubt one of the biggest public health challenges of our time. Unfortunately, like most public health threats, AMR has in the recent past been eclipsed by the response to COVID-19 pandemic. The WAAW campaign is therefore timely as it provides an opportunity to evaluate and refocus our efforts in fighting this existential threat to humankind. We note the significant and commendable strides made by African countries in developing national action plans on AMR. But is development of plans enough, one would ask? Having AMR national action plans in place is not enough. Implementing AMR containment strategies outlined in our NAPs is most important because you can only get results through action. Like Wilbur Ross said, it is important to have a sound idea, but the really important thing is the implementation. We have great ideas on paper, but there remains a gap in effectively moving from paper to action. And this is attributed to a number of factors, including inadequate sustainable financing and human resource capacity to spearhead NAP implementation efforts. As highlighted under Priority 4 of the Global Leaders Group on AMR on July 2021, Rolling Action Plan, there is a need for increased internal and external financial resources, especially in low middle income countries, to support the development and implementation of ambitious multi-sectoral One Health national action plans in all countries. It is therefore our hope that the lessons that will be shared by some of the countries presenting today will benefit others and help us move from where we are to a more desirable place. As I conclude, let me take this opportunity to thank you all for making the time to join today's session. And I wish you all a fruitful deliberation. Thank you.
Thank you very much, Dr. Fuller, for the opening remarks. We will quickly dive into our presentations. We'll be hearing from Ghana first, and to make a presentation on behalf of Ghana, we have Mr. Xavier Yevutse. Mr. Xavier is the Deputy Director of Pharmaceutical Services at the Ministry of Health and a Fellow of the Ghana College of Pharmacists with a Master's in Public Health in the area of health policy, planning and management, and a degree in pharmacy. He is the coordinator of the Ghana AMR Secretariat at the Ministry of Health, which is the coordinating ministry for implementation of their national action. He was also intensely involved in the development of the AMR policy and its NAP under the One Health approach. Mr. Xavier, we are happy to have you. Please, the floor is yours. You have 20 minutes to share with us. Thank you.
Hello, good morning, everyone. As introduced, my name is Xavier Yevutse. I'm presenting on the topic given, and I hope you can hear me well.
Yes, we can.
Yes, we can hear you.
And I hope you can see my screen too.
Yes.
Yes.
Can you put it on full screen, please?
All right, great. So to start with, I want to go straight to the point. What are the efforts that Ghana is doing to sustain local financing? I want to say that the NAP of Ghana we have started the implementation since 2018 when it was launched. We are almost in the 4th year, getting to the 5th year, probably next year. Largely, COVID has taken 1 year away from us, but now we know how to live with COVID, so we are continuing. Even in the presence of COVID, activities were ongoing, especially in 2020. We had a lot of activities in 2020. Largely, the funding for implementing the NAP in Ghana is mainly from the partners. and all other donors. We have the WHO, FAO, OIE. We have the UK government through the Fleming Fund, the Danish government, and other Commonwealth Association of Pharmacists. They all got money largely from the Fleming Fund to support majority of the activities that we are implementing. Government also provides some funding opportunities for us. And in terms of personnel time and some other minor running vehicles to be able to move to the field, the Sentinel site is supported by the government. To ensure sustainable local financings, we also developed the guideline for mainstreaming activities of the AMR NAP into the sector strategies of implementing ministries. We developed this with all the other 4 ministries and other agencies so that they'll be able to put in the NAP activities into their strategic plan for their ministries, so that when budgets are approved by the central government, and those activities have also been approved, when the money is released, they can have some fund to implement those activities. I want to say that some ministries have started the mainstreaming well. Ministry of Health is one, and the others are in the process to be able to convince the ministries, the chief directors, so that they can capture the activities of the NAP into their budget plan. In the area of governance, for us to be able to implement the NAP successfully and coordinate it properly, we have set up an AMR secretariat. According to the NAP, it has to be located in the Ministry of Health, which is the coordinating ministry for the other 4 ministries. And then we have also established interministerial committee that gives directions to the implementation of the NAP. They have a very well defined terms of reference to guide the activity. We have also identified focal persons in all the implementing ministries so that activities of NAP implementation will be well coordinated. To strengthen the governance structure, we also have a very vibrant national AMR platform. Other countries call it AMR Coordinating Committee, AMRCC. We call ours AMR Platform in One Health. We have almost all representatives, stakeholders that are very key in implementation of the NAP involved, academia and all public civil society organizations are all on board. We did not leave out the tripartite because we are dealing with the One Health approach. Everybody's hand must be on desk. We have the tripartite bodies, the FAO, WHO, and OIE, supporting and providing us technical support and most often the funding too. In the area of stewardship, just to give some few examples, if we should bring everything that we are doing into this presentation, the 20 minutes is not enough. So let me just present on some of the key areas. We have the FAO leading the animal health activities together with the Ministry of Food and Agriculture and the Veterinary Service of Ghana. They've established the farmer field schools in one of the predominant poultry product producing region in Ghana, that is the Bono region. Specifically, this is where even the Minister of Health is coming from. The main work for the people in the area is farming. They do a lot of poultry farming. So they started a school farming in that particular municipality. The farmers were enrolled into this school, and the aim is to be able to change their behavior on the use of antimicrobials on their farms. They have completed, I think 2 batches have completed so far, and they have gotten very good results. They have better yield, reduction in production costs, drastic reduction in the use of antimicrobials and antimicrobial-free products. In fact, I was on the field beginning of this year, and we had the testimonies, and I even bought some of the eggs. The eggs from these farms stay longer, and they are not bitter in taste. The quality of the meat products is unique. Even the poultry farmers themselves say now they can eat their own product because it contains less or no antimicrobials. From this success story, they need to replicate this before it can become a best practice. So they have moved to another region, the political region, basically in the eastern region. Specifically, they are in Kede, those of you who have been to Ghana before. And the school is in section now, and we are waiting to go and monitor and see whether there will be another success story over there. In the area of surveillance, we want to say that WHO has supported the child cycle project, ESB E. coli projects in animal, human, and environment. It's still ongoing. The initial results we've gotten from this initial phase is revealing. To the extent that the bacteria identified from the environment, especially the streams around us in the city, contains bacteria that are 100% resistant to commonly used antibiotics in the health system. This is a big challenge for all of us. And so also from this, it is going to strengthen our interventions on infection prevention. It means that when you even go to the farm, those who farm around these streams need to be careful not to bring these dangerous bacteria into the community. And that is informing some of the messages we are parading or raising awareness in the community in this 2021 WAAW celebration. We also have support from the Fleming Fund that is largely supporting of strategic objective 2 of our NAP, that is a surveillance system establishment and the consumption in humans and animals. We have 11 sentinel sites that has been established, furnished, refurbished by the Fleming Fund, and we have started receiving some data from those sentinel sites, those that have started, and to say that this year, 2021, Ghana is submitting data into the glass. So next year, when the story is being told, our country that is submitting data into glass, Ghana will be mentioned. It's not only about submitting the data to the international bodies, but locally, we are reviewing our standard treatment guideline in Ghana. For the infection treatment section of the treatment guideline, we need this data to inform the selection of antimicrobials for the various infection diseases that we have. The Danish government, through Danida, also supported Ghana in conducting comprehensive research into healthcare-associated infections in major hospitals in the country. We had the dissemination section about 4 weeks ago, 2 days intensive dissemination sections, and information we've gotten from there is so revealing. And there are discussions ongoing that I may even want to put before the bodies here, that who pays for healthcare-associated infection? Should it be the management of the hospital or the patients? The patients came to the hospital without these infections. Whoever introduced the infection to them should be held responsible and they should pay for it. It's a debate. You can also join Ghana and we find solution to it. This will help the management of the hospitals to put in appropriate intervention to reduce healthcare associated infections. The information from this research work is also going to inform the Medicine Selection Committee of the Ministry of Health in selecting appropriate antibiotics for the standard treatment that are under review. And also it will help in reshaping our messages and intervention in infection control mechanisms in our hospitals. As a way of stating some of the challenges, one of the things that we have seen is that the ministries, some of them are not able to mainstream AMR activities into their sector budget. If you don't put the activities in the sector budget, there's no way you get government support in implementing. So it is one of the areas we are working on seriously. And under the MPTF, the Multi-Donor Trust Fund, there's an activity to be able to help these ministries to be able to do so. There's also, as a challenge, over-reliance on a donor support, which brings the question of sustainability. Should the donors fold their arms, then the implementation will face a great challenge. Then we also have donor-driven prioritization of the NAP activities for implementation. Sometimes the donors also come with their own view, how they want the activity to be implemented. That is a bit distortion, that can bring distortion to the logical sequence of project activities as outlined in our NAP. So these are some of the challenges. Then we also have the ground level coordination difficulties due to the multi-sectoral approach. Sometimes because of the multi-sectoral approach to implementing some of the activities, some of the sectors may not be ready at a point. Just to give you a typical example, we had this bird flu outbreak. The key personalities that we used to do some of the implementation from the Ministry of Agriculture were involved, were in the field throughout the period, trying to identify the bird flus and then put in interventions. So it's also affected the level of implementation. And the regulatory challenges, we don't have effective laws, guidelines on the use of antimicrobials in human and animals. So this is a serious challenge. Whilst we are doing the awareness creations, there is a free flow of the antimicrobials in the system because the regulatory arm is weak. Thank God we now have the FAO supporting us to put all this into the proper legislations. We have the draft document submitted. So the UNDP is considering to help Ghana to be able to push these AMR issues into legislative instrument, because looking at the legal environment of Ghana, we cannot go developing a new set of laws, but we can put AMR issues into existing law, especially in their legal legislative instruments. The lessons learned as moving some of the key issues into legal framework. And this is something that we've seen that will work for us. And so, and the president has also given the directive that we should move all legal AMR issues into legislations. So that, as I said, that is the work we are doing now. We have also spread out the WAAW celebration into the regions. In fact, this year is one of them that we are having a very detailed WAAW celebration. Fridays, the mosques were flooded in some regions. We have pharmacists, doctors, nurses, talking about antimicrobial resistance. And even our mobile phones are flooded with pictures, evidence, videos. So I think that the awareness is also being created, and I think it's a big lesson we are learning. And the leadership, we have the AMR platform, and we have technical working group for all the 5 areas of the NAP. And the chairman of this technical working group are working together with the AMR Secretariat, and is providing good leadership for the implementation of the National Action Plan. And working together is another lesson that we've learned. If we work together, we achieve great work. We share strategies from the various ministries. We also look at the capacities existing in the various ministries. We call on them at any time to help, to guide, and to lead. And then the skills that they have, they are able to share. And also information and resource sharing is another key lessons we have learned. FAO, OIE, WHO is always ready to share information anytime you call on them, and then resources are available for implementation of the National Action Plan. In order to conclude, I want to say that antimicrobial resistance knows no geopolitical and sectorial barriers. That is why everybody is involved. We have very high political commitment, but the political commitment is not commensurate with the flow of funds for implementation. We have champions who are ever ready to provide the change that is required in all areas. And we want to say that resource mobilization as well as implementation of action plans at country level is critical success factor. If we are able to do this well, we'll get enough funds to be able to complete the activities that has been outlined in our National Action Plan. On this note, I want to acknowledge all the partners who have supported us in diverse ways, are still supporting us, are still on the field. The Wellcome Trust, the Danish government, the UK government, the Fleming Fund, WHO, OIE, FAO, and locally we have the civil society organizations like the Pharmaceutical Society of Ghana, that budgets, all pharmacies are levied yearly for WAAW celebration. And so we want to acknowledge all their efforts. On this note, I say thank you for giving me the opportunity to do this presentation. Over.
Thank you very much, Mr. Xavier, for that comprehensive outline of what is happening in Ghana. It is encouraging to see that despite the COVID-19 pandemic, tremendous progress has been made with regards to implementation of your National Action Plan. Some lessons there that I think we can learn and other countries can learn, especially issues around how do we mainstream AMR into ministerial budgets and plans. And I think this is very important because it ensures country ownership, but also sustainability beyond partner support. The One Health approach mechanism for coordination, I think you would agree with me that coordination of NAP implementation in countries has been one of the biggest challenges and weaknesses where effective implementation of national action plans is concerned. So it's good to see that we have a functional coordination mechanisms, and at least we have a focal point in each ministry or key sector that is spearheading implementation of national action plans. Lessons on the optimization of antimicrobial use. I think I picked one very useful example of farmer field schools. I think this is something other countries are also doing, very effective and actually works on the ground. Thought-provoking question on the issues of IPC, who should be responsible and liable, and I hope that our participants are thinking through. We could probably have a conversation around that at the end. Generating data to inform policy and practice, very important. It's encouraging to see that you're implementing the tri-cycle that is supported by WHO. I think it's a good basis for integrated AMR surveillance, and also to see that you're using results from your surveillance before contributing to the global picture or global platform. You're using this information to inform policy and practice by revising your treatment guidelines. Challenges with regulation, I think that this is a challenge that is not unique to Ghana alone. I think we have had so many countries complain about challenges with regards to regulation. And then also, how do we strike a balance between country-driven priorities as well as donor-driven priorities? So hopefully we can engage more and have conversations around this and see how best we can address some of these issues. Thank you so much, and thank you for sticking to time. We'll quickly go into, so we are seeing those comments and the questions in the chat. We'll get to them at the end of the presentations. We are now moving to Uganda, and to make a presentation on behalf of Uganda, we have Dr. Freddie Kitutu. Dr. Freddie is a senior lecturer, health systems pharmacy at Makerere University, Kampala, Uganda. He's also a member of the One Health Antimicrobial Stewardship and Optimal Access and Use Technical Working Group in Uganda, Antimicrobial Resistance National Action Plan. Dr. Freddie, the floor is yours. Thank you.
Thank you very much, Otrida, for the kind introduction. Colleagues, representatives of the different organizations, African Union, FAO, OIE, WHO, UN Environment, greetings from Uganda. I'll be making in the next 15 to 20 minutes a snapshot of the implementation and financing of the AMR National Action Plan. And I've changed the order of the slides. I've moved the sustainability slides to the end because it's generally easier to talk about sustainability when you know what you're trying to sustain. So I'll go into the activities and then I'll share my thoughts on sustainability. For those who may not know where Uganda is located, it is in East Africa. Right, the brown maroonish small country neighboring Kenya on the east, Tanzania on the south, and South Sudan on the north, and DRC, the great DRC. And of course, Makerere University working very closely with the Ministry of Health, but also with the other ministries in the One Health paradigm. I'll start with our biggest success story, which is a successful launch and eventual implementation of the AMR NAP that happens in 2018. Just to be sure that I'm being heard, Otrida, am I clearly loud and clear?
Yes, you are, yes.
Thank you very much. So this launch was high profile in 2018. For the last 5 years or so, the country has had annual antimicrobial resistance conferences. And at the one of 2018 on November 21st, the AMR National Action Plan was launched by the Honorable Minister of Health. And as you can see in the same picture, the ambassador at the time of the US to Uganda was in attendance, and many other high profile delegates and representatives, which of course ensured that the NAP was launched with the necessary vigor and energy. And what I'm going to present is basically following that launch and the energy that created. In terms of governance, following guidance from the Global Action Plan that we are all familiar with, the Uganda AMR NAP basically mirrors. So we have the One Health platform that coordinates all the health challenges that require human, animal, and environment interaction. Within that, there is a National Antimicrobial Resistance Subcommittee that oversees 5 technical working committees that are aligned along the 5 strategic objectives in the Global Action Plan, which is repeated in the National AMR Action Plan. A lot of what I'm going to talk about focuses on the Antimicrobial Stewardship and Optimal Access and Use Technical Working Committee, but I must say that together with the Surveillance Technical Working Committee, there has been the most active. All of them are formulated in the One Health paradigm with representatives from human health, animal health, and environment. And the antimicrobial stewardship one has been the most active since 2019, having very vibrant quarterly meetings where the different actors and stakeholders meet to share their findings and get guidance from a ministry on policy and practice, but also feedback into the implementation. One of the things I'm going to start with is we've successfully developed and disseminated relevant policy documents to guide implementation. And on the right of your slide, top right, you see the first page of the surveillance plan for antimicrobial consumption and use in human health. In animal health, that was developed in the One Health paradigm with the leadership of the Ministry of Agriculture and Animal Industries. Below it is the same document, but focusing on consumption and use surveillance in human health. And on the left, we have the Medicines and Therapeutics Committee Manual that was promulgated by the Ministry of Health, again, to support and guide the implementation of antimicrobial stewardship and infection prevention and control programs within the hospitals for human health. And we'll move on to just unpack a little of what is in these guidelines. Again, as expected, the surveillance plan for animal health was guided by the OIE strategy on antimicrobial resistance and prudent use on antimicrobials, where again, emphasis is on the 5 objectives that appear in the Global Action Plan, of which one of those is strengthen knowledge through surveillance and research. And particularly this surveillance basically operationalizes the monitoring and surveillance systems of antimicrobial use across the supply chain, from the national level at import through the wholesalers, the distributors, all the way to final users on the farms. Again, this system, as we've noted, the guideline was the first step of strengthening it. And currently, a lot has happened, as I'll be talking about. The national guidelines for animal consumption and use, again, were guided by the global guidance at WHO. And again, on your left, you see the GLASS methodology for surveillance of national antimicrobial consumption. We also have the guidance from the GLASS again on how to conduct monitoring of antimicrobial consumption in hospitals. So all these documents were domesticated in the national guidelines for antimicrobial consumption and use. And following the national guidelines, we've been able to do some work. And what we see is an output where we basically analyzed national antimicrobial consumption by focusing on antimicrobials distributed from the 2 main public distribution channels: the national medical stores that is supported by, that is funded by the taxpayers, and then the joint medical stores that is supported by taxpayers but owned by the faith-based organizations. We've also been able to, again, with support from the CW PAMS, the Fleming Fund, to conduct a global point prevalence surveys. And that work has been published as part of the global effort in Antwerp and UK, where Uganda with Ghana, Zambia, and Tanzania shared their findings from the global point prevalence surveys done in several hospitals across the 4 countries. And again, the data was submitted to the global database, and a lot of it informed local interventions at the hospitals where this data was collected. In fact, this paper documents some of the interventions that emerged out of doing the PPS. Currently, the hospitals that participated do their own PPS targeting particular wards where they are able to intervene. We switch to animal health, where again, a lot of work has been done, particularly developing policy documents. And I think I'll take a stop here and emphasize that some of what I'm going to talk about is probably the first of any country in Africa, and we are happy to share our lessons. The picture here shows actually the beginning of the Antimicrobial Awareness Week, Friday, where one of the implementers was handing over policy documents to the Ministry of Agriculture and Animal industries, fisheries. And there we see a representative of MSH, Medicines, Technologies and Pharmaceutical Services Program, handing over the essential veterinary medicines list that was revised after 20 years. So before this edition, the previous edition was 2001. And again, with support from MTAPS and a number of colleagues, myself included, were able to revise and produce an essential veterinary medicine list, which is very much in line with the current guidance on antimicrobial use, on the different technical guidance that OIE, FAO have provided. In the same vein, guidelines were produced for infection prevention and appropriate antimicrobial use in the animal sector, focusing on 5 livestock production systems. What we see on the slide is fish farming, and this message is actually targeting the farmers and the frontline veterinarians. It's illustrative with pictures, as you can see on the cover, focusing on how to avoid infections, but also if animals have infections, how to proceed in a rational way, in a way that ensures that we are fighting antimicrobial resistance. Now, similarly, we have for cattle farming, we also have similar guidelines for poultry farming, for goat and fish farming, and then for piggery as well. And I must say that during the conduct of this work, we noticed how scarce actually such is. A lot of this, particularly for guidelines, we started from scratch, thinking about what to include, how to present it, and I'm sure our colleagues from other countries can take lessons from Uganda. There has also been support again from the Fleming Fund, CW PAMS project, where hospitals have been supported to strengthen the antimicrobial stewardship. And here what we see, I'm using a case of one of the hospitals in Uganda, Jinja Regional Referral, which is located right at the source of the Nile, the River Nile, that many of us are familiar with. And what we did is basically to support the Medicines and Therapeutic Committee as provided for in the guideline I shared a few minutes ago, to strengthen the AMS subcommittees and IPC. The MTC basically operationalizes a lot of the priorities that are focused on medicines use, efficiency, but also on microbial stewardship and infection prevention and control. And we did this by, first of all, conducting a baseline assessment, looking at, for instance, the GPPS, looking at the health facility and health work factors, and using the information out of that to design an intervention to support the people, to strengthen the processes, and create a structure for continuous and sustained AMS and IPC implementation. Of course, this was done through workshops, support supervision, and eventually what we can say is that Jinja Hospital and 4 or 5 other hospitals that participated in the CW PAMS program have antimicrobial stewardship programs that are trying to improve and contribute to the implementation of the AMR. We'll now switch to antimicrobial resistance surveillance. And here again, a very good paper from colleagues that basically provides an account of what Uganda has been able to do, a lot with the support from the country grant, the Fleming Fund. And what we see on the slide is basically the map of Uganda showing the Sentinel surveillance system that was supported by the country grant 1 to be set up, and country grant 2 of the Fleming Fund has actually expanded the number of sites. And again, I invite you to look at this paper for additional information. But generally, I must say that over the last 3 years, we've been step by step putting in place a system that can provide information, can provide data, can generate knowledge that informs practice and policy in a way that we are able to make some gains against AMR. And this is an illustration, for instance, of how the data flows all the way from the sites where data is contributed, is produced, and that is in the light green on the lower level, through the different actors and players, all the way into the center, the One Health Coordinating Office, where there is data integration, sharing, and center. I must say that this is the framework that is proposed in the surveillance guidelines, And I must note that we've made a lot of tremendous efforts in implementing this, but a lot still remains to be done, given the number of stakeholders that are involved, but also given the complexity of actually getting this data, integrating it, and focusing on data utilization, as we shall see shortly. I must also note that Uganda is one of the countries that reports antimicrobial resistance to the GLASS portal. We are working to ensure that the antimicrobial consumption and use data can also be reported in the GLASS portal, and we are in contact with the Secretariat, and hopefully that should happen in the near future, so that we have both the AMR surveillance and the antimicrobial consumption and use surveillance data contributing to the global pool and therefore informing how to prioritize. In terms of challenges, nothing really new here, except that these challenges provide an opportunity for us for the next 1 year to basically work and report on in the next Antimicrobial Awareness Week. So there is inadequate integration of One Health. It is work in progress. Water and environment, probably similar to other countries, seems to be the least active. Inadequate government funding that of course creates dependence on partners and the attendant risks like fragmented implementation, discontinuity when projects close, limited ownership by mandated ministries, departments, and agencies. And I like the presentation from my group from Ghana. In fact, I think I've picked one message, which is to mainstream the AMR NAP into the development plan, into the strategic plans, into the disease-specific plans, all the way to the lowest level of implementation. Of course, needless to say, AMR is insidious. It's neither a disease nor an entity. So many of us usually interact with it most of the time when we face catastrophic effects, and by that time, it's usually too late. So as actors and champions, I think we always need to keep this at the bottom of our mind and find creative ways of keeping the message on the agenda for decision makers. Limited coordination at global and regional level that eventually trickles down into country spaces. But I must say that I'm impressed this week by the coordination at regional and national and global level among, for instance, OIE, FAO, and WHO, which again gives us the people, the boots on the ground, basically an idea of how One Health actually operates, and we are challenged to actually make the necessary efforts. Of course, limited progress in data utilization. We've noticed that a lot of data exists already. What is required is focusing the effort, collect it, analyze it in a way that practitioners and policymakers can actually make use of it. A lot of it doesn't require magic. It just requires effort of people with the correct skills and attitude. In terms of lessons learned, it is possible to break silos to function in the One Health platform paradigm. I think if for instance, compare the Awareness Week this year and last year, that already shows that actually we are willing and ready to work in the One Health paradigm. Relevant data already exists, as I've already mentioned. What we need is to focus on teams that actually have the skills and attitude to collect, analyze, and share. And of course, this requires collaboration, for instance, between academia and implementers. We all have different focuses, but together, I think we are greater than the sum of our parts. Again, very much related to the next lesson, collaborations among implementers, academia, and health partners is important. It cannot be overemphasized. And then as countries, as the globe, we need to bite the whole pie of interventions recommended. We cannot focus on reducing antimicrobial use without discussing about population groups that actually have inadequate access. We need to carefully balance the excessive use versus access use. And that is, again, the lessons that we've learned. But a lot, I think, in many of our communities, the challenge of inadequate access is bigger than excessive use. Our data shows, for instance, we have a very narrow range of antimicrobials available to us. Many of us still use antimicrobials that advanced health systems used in the 1950s and so on and so forth. And what we see on the slide is a newsletter that the Antimicrobial Stewardship Committee produces every 6 months. And here we have a picture from one of the facilities joining the WHO campaign to resist the resistance, which again is apt and timely for this week. Again, in terms of sustainability, I hope I don't overshoot my time. This, I think, is an ongoing question. And many times I also think about how do we sustain the sustainable solutions that I'm going to propose. I think that any implementer partner needs to always think about this. Many times we think or reduce sustainability to getting rid or becoming dependent of health sector partners. I think for me that is short-lived. Many countries today are still wondering, shall we be sustainable, for instance, as a country, as Uganda, or as Africa, given the pandemic? So for me, this is an ongoing question. However, I'll share our thoughts in terms of what we've tried to do. And the first, prioritizing AMR activities. The AMR National Action Plan was developed through a consultative process. The implementation guidelines I've shared were developed through consultation processes, and all implementers were contributing and identifying areas that they can actually make headway. And then, as Ghana has mentioned, getting AMR into plans. So that AMR does not look like that other body that has no home, that other entity that has its owners that are not part of us. I must say that Uganda, we're a bit behind Ghana, but yeah, we are taking the message of mainstreaming AMR. For instance, the National Pharmaceutical Services Strategic Plan 2020 to 2025 has a strategic objective on appropriate medical product use, where there is a clear strategy to strengthen antimicrobial stewardship at all levels. And this, for me, is a good start. The other strategic plans, disease-specific strategies, and facility-level strategies can pick a leaf from this. So we are making headway. The other sustainable solution is engaging all stakeholders. And you'll notice that I've actually borrowed the framework from a WHO document that talks about how to turn plans into action. And here, engaging stakeholders. With AMR, from today's meeting, we acknowledge that every stakeholder is actually willing and we are ready to work together. For Uganda, we've had a lot of support from health sector partners, the Fleming Fund, through the country grant, through the CW PALMS, the Commonwealth Partnership and Microbial Stewardship Scheme, the Fellowship Scheme. We've had support from USAID through the MSH, Medicines, Technologies and Pharmaceutical Services program. We've had support from the WHO TDR that has supported building capacity, but also doing some of the data that I've shared in this presentation on consumption and use, and continues to do that. When you train people, you leave the skills behind. That's one way to sustain a lot of what we are doing. Of course, USAID, World Bank, the Pfizer Global Medical grant, and so on and so forth. The other important thing about sustainability is generating and disseminating data, encouraging data utilization in decision making. And here, I will not belabor the point. We need, for AMR, for us to make headway on AMR, we need to be ahead of it in terms of understanding what is happening and acting in time. And one of the things we can do here is support teams that basically focus on making sense of the data and presenting it with clear messages where policymakers and implementers need to focus. In conclusion, Uganda has some best practices to share with other countries. A case in point, the guidelines in animal health, which again, I'll be happy to learn if other countries have similar efforts we can share and improve. But of course, since 2018, we've made tremendous strides, but there is more to be done. And I think this week is an opportunity for us as a country, but also as Africa, to reflect and collect our energies and plan for the next 1 year what we are going to focus on. That come the next awareness week, AMR and antimicrobial AMR awareness week, we actually have a lot of lessons to learn and a lot of progress to share. I thank you very much, Otrida. back to you. Acknowledgements to Makerere University, the ministries in Uganda, and the organizers of this meeting, African Union, FAO, OIE, WHO, UN Environment Program, and everybody who has found time to join this. Thank you very much.
Thank you so much, Dr. Freddie. Another great and informative presentation. It's good to see what is being done. Lessons we can learn again from there. I think you have given us an example of workable coordination and collaboration, and I think that is something that other countries can learn from. I have seen a question in the chat. We'll get to that. How do you manage to ensure that you have everyone in one place to manage that coordination? So that is something that we'll definitely be able to hear from you, so that other countries who are having challenges with regards to coordination can learn from. Another great lesson that I think we can learn is the guidelines that you develop. And clearly we can see that these guidelines are not documents that you put on the shelves to gather dust. You are utilizing them. And I think that is another lesson that we can learn. We see one important guideline that you have developed on the surveillance of antimicrobial use and antimicrobial consumption data. And I think that is one other challenge that most countries are facing. So I think that should be a great lesson to other countries, because most countries that we've come across are actually using import and export data as a proxy for antimicrobial consumption. The issues around publication, I think that is another great lesson we can learn. For those of us with a lab background, we are constantly saying if it's not documented, it was never done. So I think it's important to document the little milestones that we are achieving. It's good to showcase what we are doing, and that serves as an example and a lesson to others. The other, I think, great thing that I picked up is the fact that you have come up with an essential veterinary medicines list. That is something that is really good, because I think that most often than not, we focus on essential medicines list for the human health sector. So I think this is a very good example, and being comprehensive to go beyond and also target fish farming, another upcoming industry that seems to be using a lot of antimicrobials that we can't afford to leave behind. Integrated AMR surveillance data management system, congratulations on that. Yes, it's work in progress, and you still have to figure out how do we bring all these different data sources in the different sectors together. But what's most important is that we have a beginning point. A challenge I noted on how we are integrating water and environment, and I have seen a question in the chat to say what efforts have you put in place to ensure that we bring the environment and these other sectors on board? So maybe that's a question you can answer when we come to question and answer session. But I think that this is another challenge that most African countries have. A great opportunity presents itself, I think, at a time like this, because most of the countries are actually coming to a time when we'll be doing a review of our national action plans. So I think it's an opportunity to bring these other sectors on board that we may have left behind. Issues around inadequate funding, I think that is a challenge that we have had before. The role of regional coordination. So to WHO, OIE, Africa CDC, and all the other players, SADC, that are on board, I think this is a challenge or a call to say that it's very important. The role that you play at regional and at a global level is very important, because this is what trickles down to countries. So if we see that proper coordination at regional and global level, definitely countries will follow suit. And I think there was Dr. Freddie did comment that we have actually seen a difference where coordination is concerned for this particular year. So we hope that that is something that can be sustained. Lessons learned. I like the fact that you noted it is very difficult, but it is very possible to break silos. So I hope that those are lessons that other countries can learn from, because we can't overemphasize that. Also, the importance of collaboration between the different sectors and the ministries and governments collaborating never pass on any opportunity. The issues around balancing access versus excess, especially for our region, I think that is very important. And I've seen Dr. Water commenting on that. We'll get to that during question and answer. Last but not the least, the issues of sustainable sustaining financing for NAP implementation, and there are very good proposals and suggestions that you have put across there. Prioritization. Someone said the first step to success is knowing your priorities, and I think that is a very, very important point that hopefully we can all learn from and be able to prioritize, especially based on the available resources and the context for the different countries and the different regions. Yes, a journey of 1,000 miles begins with one step. Clearly, you have made that one step and gone beyond. So thank you very much for that presentation. Last but not the least, we are going to go to Egypt. Okay. So last but not the least, we'll move to Egypt, and to present on behalf of Egypt, we have Dr. Ahab Atia, who is the head of the Central IPC Department in the Ministry of Health and Population. Dr. Atia, the floor is yours. You have 20 minutes. Thank you.
Thank you very much. Do I have to open my presentation from my laptop, or you will share it?
Yes, please feel free to share your presentation.
Okay. Okay, is it clear now? You
yes,
see
it is clear.
Thank you. In the beginning, I would like to thank you for this opportunity to give a chance to share our experience with our colleagues in Africa. In the coming few minutes, I will speak, give snaps about the achievements and obstacles about the AMR implementation in Egypt. And in the last, I will speak a little about the financing issue about AMR and the special situation here in Egypt about financing projects. The presentation will cover the preparation of the NAP and the governance mechanism, activities, performance according to the main objectives, challenges and barriers, and way forward, and what we are coming to do in the future, coming few years. As we all know, NAP started here in Egypt about 2019. It is created at that time. It depends on 5 principles based on which the global action plan of AMR strategies have been announced. This plan is depending on 90 activities which must be done to achieve these principles. About the monitoring and evaluation, there is 18 indicators which make us know where we are and our progress for the plan. But as a hint, you all know that all activities of the antimicrobial resistance and sometimes for surveillance itself, it have interrupted by the pandemic during the last year. The strategic goals of the plan is to improve public awareness and strengthening skills, optimizing the use of antimicrobial medicine in human and animal health, strengthening national One Health surveillance efforts to combat resistance in humans, animals, and the environment, implementing infection prevention and control practices to prevent the spread of resistance pathogens. General Directorate of Infection Prevention and Control, MOHP, in collaboration with other regions like Ministry of Health, like Ministry of Agriculture, Ministry of Environment, Ministry of Interior, Ministry of Education. These are the stakeholders of the antimicrobial resistance plan. The structure governance refers to the structure process designed to ensure accountability. The governance, it depends on the integration of the stakeholders. And when I speak about the challenge, I will stress on one point of this integration, the legibility, the equity and inclusiveness, improvement of broad-based participation within a health system. These are the 5 committee or 5 groups. This is, I don't know, is it clear in the slide or not, but it is a screenshot from the plan itself. It is the communication technical working group, antimicrobial stewardship technical working group, surveillance technical working group, whether it is a surveillance in the human side or the vet side, IPC technical working group, fundraising technical working group. At last year, we this is a Ministry of Health decree number 690. It is the committee, higher committee of the AMR steering committee that it includes all of the stakeholders, focal persons in other ministries, and in the Ministry of Health itself, as the curative side, the preventive side, the infection control side, the central lab, all of the stakeholders are involved in this committee. Its purpose is to provide governance and leadership on antimicrobial resistance, monitor and oversee the development and implementation of the antimicrobial resistance. It depends on the activities of all ministries or stakeholders that meet in this committee annually and give their progress and take the recommendation of the committee to proceed. For the, excuse me, 1 minute, I think this is not the last version. Yes. In the improve public awareness and strengthening knowledge, the first principle in this, or the first target in this plan, we have distributed a lot of videos targeting the public, make them aware about the problem of abuse of antimicrobes. You know, here in Egypt, a child can order an antibiotic from the pharmacy. This is a huge problem. And when you face it by law, you are facing a huge money, you know, about this. I think it is a problem in all Africa and our colleagues, with our colleagues also. We have distributed posters, a lot of posters in collaboration with the WHO, targeting healthcare workers, some of them in English for doctors, some of them in Arabic for other healthcare workers, to make them understand the problem of abusing and misusing of the antibiotics. We do an annual awareness campaign, and one of them is running right now about antibiotic abuse or misuse. Second task is optimizing the use of antimicrobial medicines in humans and animal health. We're going to speak about this in 3 areas in the Ministry of Health, in my department, in the infection control and prevention department. We do a surveillance for healthcare acquired infections. Started from the program itself, the infection control program started from 2002, but the surveillance system started from 2015. It depends on choosing hospitals that have a criteria of having an ICU department, have a microbe lab, and a microbiologist who can read the cultures. The surveillance system is here on application on the mobile or labs. It gave us the results automatically to me here in the office and to the central lab, to make the central lab able to have accumulation or cumulative antibiogram analysis and linking microbiology reports with electronic prescribing. This surveillance is established in 40 hospitals during the last 6 years. We have here about more than 550 general and peripheral hospitals that belongs to the Ministry of Health only. The Egyptian Drug Authority have done a surveillance, point prevalence surveillance on antibiotic use, and they have done an auditing quality of antimicrobial prescribing and antimicrobial appropriate reviews. What we are doing from last year exactly to implement this on the ground, we have chosen 5 hospitals. From that hospitals doing the health surveillance, hospital acquired surveillance. We have chosen 5 of them as a pilot to establish the WAAW there and to give them a condensed training about our principles and our knowledge of this antimicrobial resistance issue. These healthcare facilities, we have reviewing existing policies and reviewing the data of antimicrobial use and resistance at their facilities, determining priority of antimicrobial stewardship activities there, holding multidisciplinary workshop with Central Lab and EDA, which is the Egyptian Drug Authority. We have done a lot of monitoring and evaluation visits to evaluate the WAAW system for data entry and quality, developing and implementing communication plan, integrated team activities pilot hospital. We are now choosing another 5 hospitals to establish the antimicrobial resistance activities at their facilities. Strengthen national One Health surveillance efforts to combat resistance in humans, animals, and environment. We have created the national surveillance guidelines of healthcare acquired infection. It is here. It is this book. 5,000 copy of it and distributed for all hospitals around Egypt to give them idea about what we need to establish the surveillance system at their facilities. In the vet side, they are doing baseline assessment for the labs they have and for research sites they have. And we have done more than 6 to 7 meetings under the umbrella of One Health to improve our experience about each other and how we can collaborate for the antimicrobial resistance principles. Implementing infection prevention and control. As I said, we have started from 2002 to establish the infection control program. We started it in 7 governorates. Then we are now having infection control program established in the 550 hospitals and all small healthcare facilities, like the primary healthcare units. Each facility, each hospital have a team of at least 5 persons. One of them is a specialist and 4 are nurses specialists also in infection control. We have trained all of them several times during the last 18 years. We have superior of them on the governorate, a team of infection control in each governorate. We have 27 governorates here in Egypt. And here in the central department of the Ministry of Health, we have our my department here of infection control. More than 12 doctors are running the activities of the infection control whole of Egypt. The activities here are distributed on the monitoring and evaluation, training, and supporting the teams of and try to solve their problems. We have done more than 550 visits for the whole hospitals. We must complete 550 hospitals annually to make a huge meeting for them to announce for the best practice hospital. But for the surveillance, we have done more than 95 monitoring and evaluation visits for surveillance. We have established, we have print infection control guidelines. The first version was 2003. Now it is the fourth version. We have distributed more than 8,000 copies. It is updated each 4 to 5 years. We are working now on digitalization of all our works. For the monitoring and evaluation, I have a dashboard here in Cairo that make me see the whole visits of all Egypt during the around the clock, 24 hours. This give us rapid results of the progress of infection control in these areas. We have created educational videos now for training for healthcare workers in the hot areas, and do IT supports for all hospitals that needs our support. This is a sample of the dashboard that I have here in my office. This is for one governorate. It gave me an idea about each hospital, the average score of each hospital, and where is the best areas and where is the worst areas in practicing infection control. The barriers that we have, I think my colleagues make it clear that the fourth point here, enforcement, the laws, enforcing of the law is the most challenging area, because if we didn't do something, we have a lot of laws, we have on paper, but there is no enforcement to do it. If we didn't work on this point, all other activities will not give the hoped results. Of course, of our challenges is the integration of the huge components of the plan and ministries and whatever. Ensure access to use-friendly evidence-based treatment guidelines, which is also a challenge for us and for the EDA. Enrollment of AMR as a core component of undergraduate and postgraduate study, which is we are working on it, and I think there is hope to do some progress in the following few months. The lesson learned, we need more studies for this issue. We have a limited data in AMR space in the region. I think these meetings that you are doing now make us more clear about where we are and what we can do together and what we can achieve. One Health approach, it's still vague idea or vague issue here in Egypt. I don't know about other countries, but working in one umbrella for more than 4 to 5 ministries is sometimes very difficult. There are opportunities for similar work amongst different partners. And I think I didn't speak about the financing issue, because there is no dedicated budget for activities of the ministry. For example, we have made a hand hygiene initiative here. There is no budget for hand hygiene initiative itself, but the budget is fragmented to the departments responsible on. For example, AMR is a training, education, awareness, and implementation. So training, yes. Sorry. So it is fragmented for a small budget in a lot of departments in the Ministry of Health. We are going to, as I said, choose more hospitals to implement antimicrobial resistance activities there. We are doing and hope to do some activities in relation to vet site. And in the last, I think it is, and everyone's responsibility is very clear from the my colleague presentation and Mr. Dr. presentation. Thank you very much.
Thank you very much, Dr. Atia, for sharing with us what Ethiopia is doing. What Egypt is doing. And again, we see very good lessons that we can learn from there. I like how that your governance structure is well established and well coordinated for proper coordination and oversight. And again, this is something that we've seen through the 3 different presentations that we have listened to today. Your efforts with regards raising awareness, this is something that we can't overemphasize. People need to know, for them to know what to do about the global challenge of antimicrobial resistance. I see that most of your efforts are focused around antimicrobial stewardship in hospitals, capacity building for healthcare workers. That is something that is commendable. You brought a different angle to the discussion. I note that you also do monitoring and evaluation and mentorship visits for the hospitals. And I think that is something that is very good. We have activities that we are implementing. How do we assess? How do we evaluate to see whether our interventions are working? And this is where evaluating our efforts comes in. You raised a very good point. Sometimes we are focused more around getting this done and having numbers and increasing our numbers, but should quantity be more important than quality? And you brought in that aspect of ensuring quality. So that I think that is another great example and lesson that we can learn from what Egypt is doing. Your efforts around infection prevention and control, you cannot separate infection prevention and control from antimicrobial stewardship, and infection prevention and control is one of the critical areas we need to focus on if we are to effectively address antimicrobial resistance. Challenges for integrating the different sectors, and I think this is not a challenge that is unique to Egypt alone. These are things that we have seen come up. The issues of use of evidence generated to inform policy and practice, and also I think the issues around financing that you brought up. So thank you very much to our 3 presenters for sharing your experiences with us and for the lessons that you have brought to this meeting. We are slightly behind time, but we will see how best we can catch up and have discussions around some questions that were raised in the chat. So we will first start with our presenters. I think there were questions around how do we ensure sustainable NAP financing. Maybe Dr. Atia, I will request that you take this one. Yes, you haven't indicated or you haven't shared with us how you are ensuring sustainable financing, but just your thoughts. How do you think that we as countries can ensure sustainable financing for NAP implementation?
Thank you. As I said, it is the situation here in Egypt. We did not dedicate some budget for the activity. The budget of the Ministry of Health as a whole, and I think the other ministries as the same. The activities itself have their fund from their sites. For example, Central Lab have their budget, which could be increased for the kits or materials or something, but they have their budget, and I cannot say this is dedicated for antimicrobial resistance activities or for healthcare acquired infection surveillance or for their regular culture and sensitivity activities or whatever. They have their budget, and I have budget for training for hospitals, which I communicate with the training department and say to them, I need more activities during this year, which will increase the budget for example, 10%. It is fragmented for all areas of activities in their related departments in the Ministry of Health. But there is no budget dedicated only for antimicrobial resistance activities.
Thank you very much. So I guess we need to be able to make deliberate efforts to ensure that we mainstream AMR into the different plans and the different budgets. So it doesn't seem like we are implementing it as a standalone. I think that would be one way that we ensure sustainability for implementation of National Action Plan. May I come to Mr. Xavier? You shared how that other ministries have already started mainstreaming AMR activities into ministry plans. Are you able to highlight more? I think there was a question on the chat asking how these ministries have been able to do that, considering that different ministries have different priorities and in the face of the different competing priorities. How have these ministries been able to do that so that maybe other countries can also learn from that?
Yes, great. So thank you very much for the question. As I said in my presentation, the uptake for this mainstreaming was a challenge from the beginning because of the varying strategies or interests or priorities of these various ministries. So we try to use the interministerial committee that's where the decision makers of those ministries came together, and then we presented the issue to them that there's the need to have AMR included in their budget and plans for the year or the 5-year strategic plan they are having, so that every time there'll be some level of funding from the central government. So that is the approach we are using the interministerial committee to put the pressure on them to be able to include. And then we also need to package the message well to them. Especially, remember, the heads of these ministries are politically appointed. The politicians have their own agenda. What they want to do is to have the interest of the populace, not the fine things that affect sometimes our lives. So, but you need to involve them. And we are lucky, Ghana, the Minister for Environment is a heart surgeon, a consultant in heart cardiologist. So he knows much about this. And so that is why they are always on board. And the issue now is we have seen that some have started, others are not doing. That is why we have another intervention to bring them together. Let us bring the evidence we are gathering again before them. And then when it is time for their budgeting season, we start engaging them, and then we can select some of the activities for them to put into their budget and pray that government will release the money. Sometimes they approve the budget in parliament, but they don't release the money. Over.
Thank you very much, Mr. Xavier. So having to engage at the highest level possible, controlling officers, ministers who mostly are politically appointed, how do we make AMR attractive? How do we bring it home so they know that this is important and they should be able to plan and budget for it? So the evidence to support our argument becomes very, very necessary. So I think that it would be important that we learn this lesson that we need AMR to reach the highest office possible. There have to be those clear linkages and pathways, but it should be, again, low enough to ensure that it's operational at the different levels. So there was a question for Dr. Freddy in the chat, but before we come to that, how do we strike a balance between country priorities and partner-driven priorities? So for this one, it is not specific to our presenters. Any participant who think they have something to contribute or who want to contribute, please feel free to contribute. How do we strike a balance between partner priorities and country priorities? Anyone on the chat?
Hi, Otrida, Freddie.
Okay, yes, Dr. Freddie.
Yes, I thank you. Let me volunteer to take a stab at that. Again, thank you very much for the person who raised the question. My yardstick really is ensuring that the country has clear situation analysis and understanding of where they are. Because as we know, efforts in AMR, like other interventions of public health relevance, are incremental. So you want to ensure that any available resources are building onto what you have already, and they're making the most reasonable and strategic investment at the time. Because if for instance, you jump certain steps, then most of the time that investment either becomes a white elephant because the situation, you're not yet ready for whatever you've invested in. So for me, the yardstick is where are we as a country and what is the most logical step? So for instance, if we have guidelines and the next step is disseminating or piloting them, then you need to work with the partners to ensure that they understand that that is the most logical step. Of course, it could be give and take, but generally I think our health sector partners, at least they always say they are coming to support country priorities. So the issue is about how you interpret country priorities, because sometimes it's not that the donor has an interest, it's just a difference in opinion in interpretation of what the country priority is. And many countries in AMR have many priorities. The question is, what is the logical next issue that we need to solve in a way that we continue building on our progress? That's my stab. Thanks, Otrida, back to you.
Thank you so much. Thank you, Dr. Freddie. Kimani said, understanding AMR from a political economy perspective is key in raising awareness towards national sustainable financing. Thank you very much for that contribution. There's a hand, I think Brian raised their hand first, then we'll hear from Brian and then we'll go to Mark. Brian, over to you.
Thank you, Dr. Kafuna. And this is Brian from Ghana. I also would share some context also in our situation in the country. I work closely with Dr. Yebuche, who just presented. On the matter of partners and how we manage that interface when it comes to prioritizing our national action plans. I think one key important thing, in addition to what the earlier speaker has said, is that countries must also be assertive about their action plans and their positions or intent on AMR. For partners, I mean, partners will come. There would be objectives, so there would be a focus for partners, but then country priority is critical. So on that note, it's important for countries to be assertive after they have developed national action plans about how decisive the country is, how they have done wide stakeholder consultations, how they have unified their intent about exactly what is important for country. And when that is done, a lot of partners would align if they are properly engaged. You see, so that is one, the assertiveness that countries must attach to their national action plans. The second area, I believe, is about sharing these plans widely, because frankly, there are partners who would actually look at country action plans and then also prioritize their engagement with country. So in that note, when your national action plan or when for any other plan for that matter has been widely shared, you realize that even before partners engage or before you attracted some kind of partnership collaboration, the agenda has actually been aligned with country priorities sometimes, and that can also help. The third bit and the last one would be that when global agenda is set, and country plans also align with global agenda. Global partnerships or the partner community normally would also align with the global agenda. Okay, so for instance, we have partners who have actually decided before they even approach country, have decided that, okay, they are going to invest in surveillance. Surveillance has been set as a global agenda already. So if a country has aligned with the global surveillance agenda, then it's a way of unifying our direction and intent already. So countries' ability to align with global agenda is also a catalyst to aligning with partner intent. Thank you.
Thank you so much, Brian. Alignment with the global agenda, but also countries being clear and being able to share their plans, because as and when a partner is coming in to support a country, they would have looked at what you have put in place and what your priorities are stated for that. What surveillance, but at country level, and when it comes to the nitty-gritties of implementation, what kind of surveillance is priority for the country? What do they think they want to do surveillance in? And what is the partner's area of interest? So I think that sometimes it's about the nitty-gritties, the granular elements or issues when it comes to implementing the already set broad agendas. Thank you so much. We'll hear from Mark, then we will come to Kimani. Thank you.
Thanks so much, Otrida, and thanks so much for the contributions from other participants. I think the issue of prioritization cannot be overemphasized, because that is one of the key areas that I think is been lacking in most of the national action plans that most of the countries have developed. And I think some countries have attempted to prioritize their national action plans. I come from the Southern Africa region. Zambia is one of those countries. And as Otrida has said, it gives kind of a sequential way and prioritizing what Otrida says, the nitty-gritty of how activities needs to be done. And also, as Freddie said, putting them in some sequence in which they need to be implemented. So I think this is one of the key issues that most of the countries should consider doing. And I think at this point, there's really no clear guidelines or framework on how this can be done. And I think this is now where the tripartite should come in and maybe develop some framework that can guide countries on how they can do this prioritization of their national action plans. So I think this is one of the key issues that is coming out, and I will encourage that a kind of a framework be developed, not only for the countries, as also I've seen from the chat, Chandia has said, we also need to have some regional framework so that as the countries prioritize their NAP, we also have the region also coming up with a prioritization framework, which can actually guide the best way in which countries can actually do resource mobilization and in some sequential manner implement their national action plans. Over to you. Thanks.
Thank you very much for that contribution, Mark, and I totally agree with you. So we are running behind time. There's one additional question I think would be important for us to discuss, and this is how do we ensure, because I don't think that has clearly come out. One of the challenges that has been listed, I think, presented by our presenters is the fact that NAP implementation funding is mostly by donors. How do we ensure that the political commitment we keep hearing about at country level translates to financial commitment? I think that is a question that would be very important for us to answer before this meeting ends. So I will allow Shadia and 30 seconds, and then Kimani under 30 seconds to make their contribution, and then we can move to answering the question on ensuring sustainable local financing. Thank you.
Thank you, Trida. I just want to highlight that we have already tools that we can use for the costing and the budgeting of national action plans. For example, I put in the chat the WHO tool that can be used for this. And this then can be shared with the donors and the partners, development partners, around the national priorities to seek funding. But most importantly, we need to have also domestic funding, not just reliance on partners to fund the national plans. Thank you.
Thank you so much, Shadia, for that contribution. Member countries need to be able to utilize the tools that have been made available by the tripartite and other partners when it comes to prioritization, but also budgeting and all. Can we hear from Kimani under 30 seconds? Then we can discuss further issues around sustainable local financing.
Thank you. I just want to add a dimension of the economics and policy and the political, because we need to have data and package that data in a language that the very high policymakers understand. And they don't need the technical details. They just want to know how does that impact their national GDPs, who is affected, is it the poor, and is it people who have a huge vote or political, they can make political noise. So understanding the political economy is important, but also I've seen a lot of funding released through political processes. So we can't ignore the political processes that we need to engage to get AMR funding. So we need the data, package the data, communicate, and then engage in a political process.
Thank you so much. Knowing how to properly package our data and communicate to different cadres and different stakeholders, very important. Thank you. So could we please have 2 comments from our participants on how we ensure that the political will translates to financial commitment? And then I would request that maybe we get a comment from the representative from the tripartite and also AU and Africa CDC on how you think that you can support countries to ensure that there's a balance between the different priorities that funders have and what partners have, but also maybe comment on how do we advocate or support countries to ensure that there is that country ownership and also resources are set aside at country level for NAP implementation. Hane, is that a new hand? You can comment, please, and then we can hear from Sumaya.
I think it's on hand. No, maybe Sumaya
Okay.
can do it.
Sumaya? Okay, is there anyone else who would like to make a contribution on that? How do we ensure sustainable local financing? How do we translate the political will and commitment that we keep hearing about, that we see on paper, to actual financial commitment for NAP implementation? Anyone? Does any of our presenters want to comment on that before we move to the tripartite? So Dr. Zizwe says the issue of financing NAP, okay. While the issue of mainstreaming AMR in ministries and departments is appreciated, the reality on the ground is that AMR is treated as just another technical matter whose activities has to get crumbs on the existing budgetary small cake, whose allocation is in most instances are dwindling over the years. So how do we address this challenge? We have a comment from Mitupa. Sorry, I'm unable to turn on my mic. The point on packaging data was invaluable, having the data set in a way that emphasizes action after ending at awareness. Thank you very much for that contribution. Can we get a comment? How do we translate this to actual allocation of resources? Lewis, yes.
Thank you. Thank you for this opportunity. I think one is to acknowledge the financing situation at country level. Normally, I'm speaking from an environmental point of view. What we have noticed from an environmental point of view is that there is competition for national budgets. And you have to, normally you have to justify to the Ministry of Finance and Planning why you need priority, why you should be prioritized. And one model we have seen to work is from evaluation point of view. For this instance, we have looked at evaluation of ecosystem services and seeing what the contribution of ecosystem services to national GDP is. If for the few countries we have managed to show that the GDP of countries benefit to a certain extent from healthy and productive ecosystems. We have seen the ministries of planning, treasury, and finance being more receptive to ministries of environment when they request for budget allocations. So the beginning point, of course, is mainstreaming, as we have heard from the different presentations from Ghana, from Uganda, and from Egypt, which is very good. I'm very impressed. But then the next step is we need some tools that could demonstrate the contribution of preventing AMR to, for example, the national health system, the contribution of preventing AMR to, and how it contributes to the GDP. And then probably approach the planning and finance ministries with this data and show that if indeed we invest in preventing AMR, we are going to see a certain increase in GDP from this point of view. So there is, to summarize what I'm saying is that we need some tools, valuation tools that could be used on AMR, and then use these tools in advocacy and in planning and budgeting for the sectoral ministries. Thank you very much.
Thank you so much, Lewis, for that contribution. The emphasis on mainstreaming AMR into the different government and ministerial plans. You can't afford to have it seem like it's a standalone program. We need to be able to incorporate and leverage on the resources that we have for infection prevention and control and for these other activities. Then tools, we need to be able to build an economic case. Numbers like Chadia said sometimes will not work, especially for our political leaders whose interest is really not in numbers, but how do we build an economic case? And I think that is very important, and that's a lesson that we have learned from the countries that we have presented today. Thank you so much for your engagement and your valuable contribution. We would like to take a group picture at the end of the session. So we'll be asking you to turn on your videos for us to take a group picture, and our hosts will help us with that. But before we conclude, could I just request that maybe we get a comment from the tripartite and from Africa CDC.
If I may, Trida.
Sorry.
Yes,
Yes.
Kadia.
Thank you. I just want to highlight that in all the presentations that we had today, they mentioned the coordination mechanism and the governance structures. When all these issues comes under one coordination mechanism, be it the One Health platform or other forms of coordination, this will help us to present comprehensive and one list of priorities to the finance ministers or national authorities. So we are not fragmented from all the sides involved in AMR work, human health, animal health, and the environment. We have to be united and ask with one voice so we can get the financing that we need at domestic level. Thank you so much.
Thank you, Chadia. I couldn't agree with you more. Sometimes we overlook or underestimate the power of coordination. And I think this is something that we have learned from the countries that have presented today. And it's good to see that this is something that is working, because it's actually the weakest link to effective NAP implementation at country level. So thank you very much for that. Are we getting a comment from the tripartite or from Africa CDC, especially on things around how do we support countries to ensure sustainable local financing, but also the issues around prioritization? Maybe we can get one comment before we take a picture and then we conclude. I think Dr. Fuller, you asked in the chat, how can the tripartite and Africa CDC support? Did you have questions, or maybe you could share your thoughts around what you were thinking? I know you posed the question to the member countries, but could you share maybe your thoughts around that?
Well, when it comes to financing of national action plans, we know that it is a very critical issue, and there needs to be some sustainability. We also understand that context-specific and national actions will be very critical in ensuring that we have sustainable financing moving forward. Yes, we like to ensure that we can have external financing, but I think the most critical aspect is that internal part of the financing. And I think Ghana mentioned it quite well. There are already existing programs where AMR can be mainstreamed into. And I think that is one approach we can take to ensure the sustainability of implementation, but to also ensure that there is some kind of a budget for AMR activities. And but also, there are private sector partners in the country. And so if countries will take the time to try to map out their internal partners, some kind of a stakeholder mapping in this area would be very critical, and then find a way to get those partners on board. And I think this is where buy-in at the beginning of the development of national action plans becomes very critical. Because if you have not gotten someone involved in the beginning, sometimes it might be difficult to get them when you are looking for resources. This is why we promote this One Health approach, interdisciplinary approach, and involving all critical stakeholders and partners from the public, private sectors, faith-based organizations from the beginning, so that everyone feels involved, everyone feels that they have a stake in this, and everyone can therefore contribute effectively. Over.
Thank you very much, Dr. Fuller. You have adequately summarized the thoughts around the discussions we've had. So I hope that we have learned one lesson or two as countries that will help move us, like Dr. Fuller said, to from where we are at to a more desirable place. Yes, it's commendable we have national action plans in place, but the real work begins when you have to implement, because that's how you address AMR, it's by implementing the different strategies that you have outlined. We don't want beautiful ideas on paper, documents that will sit on shelves and gather dust. So I hope that this session has been very helpful. Thank you so much again to our presenters for making time to share your valuable experiences. To the participants, thank you for having joined us and being part of this session. We are very, very grateful for your engagement and for your contributions. Remember that what's most important is you at least implementing something. It's the small, small steps that you make that will lead to the success that you want. Like someone rightly said, the journey of 1,000 miles begins with one step. Implement one thing today, you add another one tomorrow. And please remember, I think one other lesson we learned from Egypt is that there's no one size fits all. Look at what is workable for your country and start from there. So thank you very much. It's been an honor to moderate this session. Thank you so much. I will hand you over to Chadia now. Thank you.
Thank you very much, Trida. It was really very informative and insightful sessions, and the presentation were excellent. I hope we can share the presentation with all the participants on the call and on our email listserv. I would like, before we conclude, invite you to our session tomorrow at the same time.